Hello, everybody, and welcome to your PEDS ICU rotation. This is a brief orientation to your rotation for this month. Basically, to go through what to expect over the course of the month, the way your day is going to work is that you pre-round at 8 in the morning. Our morning report is from 8 to 8:30, or you have fellow lectures on Mondays and Thursdays from that time in lieu of your morning report. 8:30 a.m. your rounds begin. 9 to 9:30 are radiology rounds, and then after that we come back to the ICU, complete our rounds, and you go about doing your tasks for the day. In the noon to 1 is your noon conference, and you have the afternoon 1 to 4:30 to continue to take care of your patients, admit new patients, do procedures, call consults, etc. And at 4:30 your evening sign-out rounds begin. To prevent duty hour violation, those residents that are on call overnight will have to sign out by 9:30 in the morning and leave on your post-call day. So you will hand your patient papers over to the other resident on your team, and they will actually present those patients on rounds. Resident teaching conferences, as I mentioned, happen Mondays and Thursdays from 8 to 8:30 in place of your morning report at the front desk in the PEDS ICU, and are given by the fellows on service or on post-call fellows. Other teaching conferences that you're welcome to come to occur on Tuesdays 7 to 8, and noon to 1 is the PEDS ICU Fellow Conference. Thursdays from 12 to 1 and Thursdays from 3 to 4 are your sign-out rounds, which you're also welcome to come to. Other educational resources that are available to you are on the PEDS ICU website. There's a handbook available. These are all of the chapters that are present in that handbook that is available on site. There's a few tables as well that are easy reference for when you're on call. There are two teams in the PEDS ICU, Team A and B, cleverly labeled. Team A and B are all going to have the attending physician, a fellow, a senior pediatric resident, and a junior pediatric resident. Team A will have the nurse practitioner, and Team B will have the ED resident. Your role in the ICU will, of course, be to come in, sign out from your overnight resident, pre-round, be ready to present your patients at 8:30 in the morning, and to carry out the plan for the day. If there are any management changes that occur or other teams suggest on the patients that you're covering, make sure you discuss this with the attending or fellow on service before carrying it out. The more you're present in the ICU, the more you'll be allowed to do. Any new admissions, make sure you discuss the management plan with either the fellow or attending on service or on call with you. Other team members in the ICU include the nurse practitioners. There's presently two of them, Julie Reed and Kirsten Wells. Remember that these members are in the ICU basically 365 days out of the year, so they really know the ins and outs of the ICU. So they'll be a great reference for you should you have any questions in the ICU. Other things that they will do in the ICU is actually partner with other consulting services, primarily the neurosurgeons and the liver transplant team. So they will round with those teams in the morning and will update you on the patients that you may be covering, so you know what the plan is from the consulting services. They will also help care for patients, particularly if there's residents that are in clinic. They will cover those patients, get sign out from them, help cover those patients, or help admit new patients during morning rounds, etc. And the number of patients they cover will be determined by how many patients there are in the ICU. Other trainees in the ICU include the anesthesia fellows, who will not cover patients and they're only present 6 months out of the year. The ED residents will be on Team B and essentially are like the pediatric residents. The one thing to remember is that they will not be there on Wednesday mornings due to their ED conference, but will pre-round on their patients and will hand you the notes prior to going to their conference. Two types of medical students. There's those that do the critical care clerkship and those that do their sub-I. The sub-I medical students are further along in their training and will need less co-following of their patients by the residents. PICU evaluations of the residents are done as a group at our faculty meetings regarding to getting feedback at the time of your rotation. Make sure you elicit that from the attending that you're on service with. As far as the notes go, every new admission to the ICU will need a full H&P, whether it's a trauma or a transport or an admission from the ED. The post-op patients will need a post-op admit note, which is slightly different. All patients need a daily progress note, and patients that are in the ICU for longer than 5 days will need an interim summary weekly. All of the PICU notes are available online. And for transfers, make sure that they have a transfer note available if they've been in the ICU for greater than 48 hours and that you've signed that patient out to the resident on the floor. Often post-surgical patients will only be followed by the surgical team and don't need a pediatric co-follow. In regards to rounding and presenting your patients on service, often we will have consulting services that come and round with us. These are the notes that are available to you. You can either present directly from notes on the computer or feel free to print them out. Just some tips to consider when you're pre-rounding. And the next few slides basically cover the specifics of presenting patients, which I will not go through, but feel free to read them. Once you've completed your presentation on the patients, make sure that there's a one-line summary, that we have reviewed the orders, we've addressed the bedside nursing concerns, and that we addressed the patient dashboard. And here's a bit of information about the patient dashboard. In regards to procedures in the ICU, all procedures will go to the ICU fellow to begin with, particularly if it's a first-year fellow, as they have to be trained in the procedures during their critical care fellowship. In regards to if the fellow chooses to give up the procedure, either the resident or the nurse practitioner covering that patient will have access to those procedures. Procedures that you should try and particularly learn when you're in the ICU are how to bag mask ventilate a patient, how to operate an anesthesia bag when you're actually using the bag mask ventilation, how to place peripheral IVs, how to do chest compressions, and how to use a defibrillator. In regards to bedside nurses, make sure you communicate with them so they know exactly what your thoughts are, what the team's thoughts are in managing that patient. Particularly if there are orders written, as sometimes there can be a delay in those orders if they're not directly communicated with that bedside nurse. All nurses carry an ASCOM phone with them, so just contact them on that phone. Make sure that the nurses are present whether we're doing morning, evening, or midnight rounds. And the nurses are your eyes and ears at the bedside. The more you're engaged with the nurse, the more they're going to tell you about how the patient is constantly changing. In regards to orders, when you put them in, don't put in a time for either lab draws or drug delivery, because it makes it easier for the bedside nurse to actually do that based on the lines she may have accessible in that patient. Each day, the patient needs to have morning labs and x-rays ordered. There are PICU-specific power plans available on Cerner, and here they are all listed. In regards to the actual bedside cows, make sure that you sign off so other people don't have patient data accessible. Make sure that you actually plug in the cow when you are done with them. Finally, you are the doctor for your patient, so take ownership for them. The more you do for your patient, the more we will allow you to do as the ICU team. Be involved, be engaged, be present, ask questions, and if you have any thoughts on how to make this rotation better, feel free to contact me. This is my contact information.